Welcome to the Prime Health Podcast with your host, Dr. Derek Barron. Dr. Barron interviews doctors, wellness experts, and healthcare leaders who are revolutionizing how we approach health and longevity. The Prime Health Podcast explores breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. So sit back, listen in, and prepare to transform how you think about your path towards Prime Health with Dr. Barron and his special guest.
Welcome back to the Prime Health Podcast. I'm your host, Dr. Derek Barron, and I'm here to bring you cutting-edge insights and practical strategies from leading health experts for your journey to prime health in life and in business. Now, my guest today is Dr. Justin Hogan, a practitioner who's redefining what healthcare should feel like. Instead of settling for normal lab results, he listens, looks deeper, and helps patients reach their prime health because for him, normal isn't the goal, it's just the starting point. Now, before we jump into conversation with Dr. Hogan, just a quick message from our sponsor, Growth Solutions, where we believe brilliant healthcare professionals shouldn't have to choose between patient care and practice growth. We handle the business side so you can focus on what you do best. We eliminate a lot of the big headaches, whether it's new patient lead generation, if there's communication breakdowns. We try and create a lack of operational chaos by implementing proven systems and frameworks. And yes, we help you integrate some AI and AI agents so you can enjoy life and practice again. So Growth Solutions is not an agency or a vendor, we're your partner in growth. So if you ever thought this or said this, I'm too busy to grow, too slow to scale, or too overwhelmed to fix it, we can be your solution. Just drop a question or a comment below. My staff or myself will get back to you. But you came here for a reason, and that's to see our guest and hear what he has to say today. So Dr. Justin Hogan, welcome to the Prime Health Podcast. Please tell us a little bit about yourself and what you do.
I am born and raised Houston, Texas, so Texan boy. I run a functional medicine-based practice here in Magnolia, Texas, where we pretty much, I would say, it's more concierge-based, so we don't take insurance. But our main focus, I would say, there's three pillars, actually, of our practice. So hormone optimization, nutrition, and also movement. And so I try to kind of educate patients more a little bit about kind of what that does and how they can actually optimize and prevent, based on optimizing each one of those sections or each one of those areas. And obviously, if you're deficient or one of those areas aren't optimized, then health tends to kind of decline or actually fall in the opposite direction. So we do a lot more in the practice. We do a lot of testing. We do a lot of testing within our practice, and more just convenience, where we drop ship everything to our patients. Whether that's hormones, whether that's supplementation. So we try to kind of, make it way more convenient, but a style that's more based on education versus just writing a script and sending it to the pharmacy, which is kind of like the old school way of medicine, but obviously brought to more of a current state. So,
yeah, the old clinics of the old days where the doctor would take some time, know the whole entire family lineage of what was there. You're trying to bring back some old school feelings with some new school technology is what I'm seeing.
Right.
Yeah.
I mean, patients always want that conversation piece. And I think I was very, very fortunate in residency to be taught more that bedside manner, to sit back and listen. Our attendings used to always not give us the charts, just to send us in to have a conversation piece before, so you don't already have this just massive thought, okay, they come in with chest pain, but it actually could be something else.
Yeah.
Or just looking at something based on labs and saying, hey, it's infectious versus non-infectious. Yeah. So it allows you to think like a clinician again, but it also allows the patient to kind of have a voice and speak, which I think patients always tell the story when it comes to even just symptomatology. So if you just take a step back, listen, patients tell the entire story of kind of which direction to go. The labs help us, I would say, as a guide, but don't really force our hand. We've always been taught, no, you're in the normal range, or it's this. So it could actually be something else like depression, anxiety. And so for me in my practice, I try to take a lot of time, not only talking to patients, but also educating them on how they can optimize, but also take that proactive approach versus just reactive. And so it's a very different style of medicine than actually what I was trained traditionally. But my traditional side and my background's internal medicine, which I still use a lot of it. It provides the foundation and groundwork to expound upon other things, like whether it's diabetes, whether it's hypertension, cardiovascular disease. And so we take a lot more of an advanced approach, but also educate patients on also nutrition and also just movement, and like how can we combine all three sections to actually optimize health.
Yeah. What were the three sections that you work on again?
So hormones, nutrition, and movement.
So,
and I say functional movement, but I mean, obviously movement can be walking, it can be running, it can be crossfitting, but it's also teaching patients to how to like move properly.
Okay.
Not just to go out and just run or do something and just try to do some sort of HIIT workout. Every patient's different. And so you have to find kind of what's going to work best for them.
Okay.
Also from just a functional standpoint, do they have back pain? Do they have neck pain? Do they have some sort of shoulder injury? Do we need to actually focus on that and teach them how to work around that so they can still achieve that cardiovascular benefit?
Got it. So I want to come back and ask some of those questions, but I want to jump back in time here. So was there a moment in your, upbringing when you were a kid, teenager, something that said, I want to have a career in medicine?
Say this. So I'm actually our first physician of the family. I've always had an interest in, I would say, the human body, and I'll kind of take you through a quick little story. So played sports my entire life. So when I actually got to college, I was like, man, I would love to be on the sidelines, be able to help athletes kind of return, and just help them through that health process through injury. And so I started on that path of pre-physical therapy at Texas State University. One of those rotations, we actually had to go and just do some sort of volunteer work. So I chose a derm facility within Austin, Texas, because I lived in Austin, but I actually commuted and drove to Texas State University. And I trained under a very, very good Mohs surgeon who really, really kind of turned my passion towards not only just, I would say, clinical medicine, but also just working with your hands. Whether that's suturing, whether that's cutting, whether that's just learning a little bit more of that aspect. So that drove me then to pre-PA school, which is essentially pre-med. So right. I had a little bit of a shift, and then I was like, why go, just a little bit of the way when I want to go that ultimate in range of being a physician. Mm-hmm. And look, there's some phenomenal PAs and NPs out there that are really, really good. I think for me, I just wanted to have a little bit more authority over and not have someone above me that I actually had to kind of answer to when it came to owning a practice. Mm-hmm. And that's kind of why I kind of pursued that path, I would say. When it came to like step 2 of my path of what I do now, like functional medicine and hormone health, that's a little bit of a different story. I would say that not getting into, I'm from Houston, interviewed at UTMB Houston, getting into residency. I did a lot of training in Baton Rouge, Louisiana, and that's where I ended up. So kind of not getting my first choice and going second choice. I was more hospitalist trained. So a lot of patients, a lot of just floor medicine. But it's a very fast pace of life where you're just patient, prescription patient. And so I was a little bit frustrated with that traditional model. So first year residency, ended up locating a physician that's been doing hormone replacement therapy, Dr. Neil Rouzier. My first conference was actually in Salt Lake City, Utah. After that first conference, literally I was hooked. And so I spent a lot of my last 3 years of residency teaching myself and going to conferences and, learning more about hormonal optimization, because typically most traditional programs, hormones are bad, or hormones are, it's you do them for a very short period because there's risk of cancer and malignancy. But obviously I was taught the complete opposites. And that's kind of what changed my path of medicine and just that drive of wanting to optimize from inside out versus just writing a prescription.
Okay.
That's
so
kind of a long story, but
no, that's okay. So that brings, as you start to talk about hormones, so I think that there's questions. I think controversy is a bad terminology to use with it, but your thoughts on synthetic hormones and why you think there is a rise in hormone replacement therapy that's going on right now.
So, I feel like hormones have taken off I would say in a good way, because we're educating our patients on a lot more of the differences between synthetic versus bioidentical. Synthetic means that obviously it's not identical in structure of what our bodies naturally produce, whether that's, from the testes or actually from the ovaries. And so when you look at synthetics and what they do and the side effect profiles of what they increase risk for, whether that's cancer, whether that's stroke, and increase your risk for heart attack, one of the biggest trials was the big WHI trial. And, when you add a synthetic progestin or progesterone to that, you get an increased risk. And so for me, when you look at the bioidentical state of it, there's actually, if it's identical in structure of what you normally produce, and there's all these benefits of hormones, then why can't we continue hormones past that state of whether a male hits andropause or a female hits menopause? And so there's so many benefits all the way along, but then we all kind of group bioidenticals with the synthetics that cause all the problems. And so that's kind of I would say the shift of where we're learning more and teaching patients more about the overall benefits. Because if you can take a male whether that's 40, 50, and we're doing replacement therapy, you're increasing a lot of things, whether that's decreasing their risk for cancer, decreasing their risk for stroke and heart attack by actually losing and decreasing visceral fat. That actually puts us at a lot of risk. Versus just saying, hey, he's normal at 400, and saying, hey, you just got to keep working out and just keep taking some creatine and protein and trying to optimize a different way. You have to find and look at the real data. And the problem is, I think people group the name progesterone or the name estrogen as all the same.
Okay.
So there's a blanket basically model that when someone's looking at a study, you have to look at it, is it truly estradiol, or is it a synthetic estrogen like, Premarin? Premarin comes from pregnant horses. And so that's a synthetic that's obviously, when you add it with another synthetic, which is called a progestin, there's a massive increase in risk. And so that's where I think the confusion came along. It's like, okay, hormones are bad. They cause cancer. They cause strokes. They cause heart attacks. I'm not saying that there's not some risk involved when it's mismanaged. You have to always follow levels. And that's kind of where my practice and what I've learned is to really, really do your due diligence with your patients, especially when you're looking at CBCs and just blood counts to look at, because like testosterone naturally increases red blood cell production, which can be a good thing. But if it's too much, then there's too much volume. When there's too much volume, then you get an increased risk in, hypertension. And that hypertension then increases your risk for stroke. And that's where that risk factor kind of comes into play. And everybody's like, hey, your testosterone is way too high. Like, it's going to cause a stroke. It's like, but if everything's normal, they feel better and their markers are improving, whether that's from an inflammatory standpoint or even from a metabolic standpoint, you're looking at insulin resistance, you're actually doing way more good than harm there.
I think this is where your past personal medical history of being an internist comes into play versus, and not trying to say anything about other clinics that are out there, but you see these male hormone clinics that are popping up that install a provider, physician, PA, nurse practitioner, whatever it may be, that is just looking at simple numbers because they're providing the patient what they want, not always giving them what they should have.
Yeah. Or I would say that there's some really good providers that have grown their practices so significantly that they then create a cookie cutter approach. And I'll tell you this, a lot of people think because I'm male, I see primarily male patients here. I'm probably 80-20 female male.
Wow.
Based. I still see a lot of males, but again, you have to look at the real factors there. And every patient has to be, it's such a customized, personalized approach because everyone's number is different. You can't take this range of whether it's female or male and say, okay, like, let's just say, for instance, males is normal CBD, like I would say up to 50, 300 to 800 to 1,000 is considered normal. But it's like there's this entire massive range where, like, where do you feel the best is the question. What's the risk of going from 800 to 1,000? If they feel better there, like, well, hey, it's high. They're out of range. Like, it's meant to decrease as you age because that's what happens with aging is that hormones do decline as you age. So you stay normal because that's what happens. But for me, it's what is the optimal state for you as my patient, and how can we take that to another level where you feel your best, and we're actually helping markers change from a longevity standpoint.
Yeah. And I'm gonna guess that the numbers that you deal with there's so many dependent factors on how healthy is that person to begin with. What's their sleep patterns like? What foods do they intake? Are they eating healthy, or are they eating the standard American diet? And all of those are going to play on what you may be prescribing or suggesting as far as the medications.
Yeah. So, I mean, when I do a first visit, I'll usually have a standard panel, and I say, hey, we use the word standard, but that's my standard panel. I mean, we look at a full CBC, we look at a full metabolic panel, look at kidney, liver function. I look at an A1C, I look at a fasting insulin. I do look at hormones. And then we sit down. I don't go over labs until the very end. Patients are like, what's my number? What's my number? And so but it's a nice conversation piece, because they learn as we talk and we hit symptoms, and I'm like, this is what this hormone does. Then we say, okay, let's look at numbers now. And they're like, oh wow, like that makes complete sense. Sometimes the numbers don't make sense because they're normal or they're mid-range, but they have every symptom like in the book for either low T or just low progesterone, for instance. Mm-hmm. And that's how you should treat patients, not just looking at a number and say, okay, like, let's just get you normal. You have to spend time looking at nutrition. Is the hardest thing that I do. I mean, I think that's anywhere. We all come from different backgrounds. We all come from different cultures, and we live in different states. Like, what's your access point? Do you live in a small city? Do you live in a big city? Not everyone has to go to Whole Foods and eat, straight organic and just from the pasture. Yes, I always teach whole foods is best, but sometimes that's not I would say it's not the most optimal case for a patient that's, let's take a single mom that has 4 children, and she's almost acting like an Uber driver, driving kids to school, driving kids to baseball. Teaching them how to eat on the way and playing a little bit is sometimes hard, but I mean, again, that's the joy of what I am, like, helping them kind of figure out that direction, I would say. Mm-hmm.
That's the rewarding part of it, I'm sure. I mean, there's a lot that's rewarding in that, but when you see a mother of 4 that can be affected by small changes in a positive way, is not only helping her, but it's helping her family. That's a great feeling that you probably go through. Yeah,
it is. I mean, it's nice because it's watching patients in their transformation here. It's not even just looking at numbers on a page saying, hey, my testosterone improved, my weight went down, which is obviously good, but like watching just their mood and response and just motivation to kind of do better is probably the best, like I would say the most rewarding thing. Yes. I mean, I love watching numbers move and it, like, depending on what the number is, but you have to take the numbers out and just really focus on really what's going on from a symptom standpoint, and use the numbers as a baseline or an association.
Yeah. So there's, the news is covering it like crazy, GLP-1s, peptides. What's your take on those and the safe way for patients to potentially approach the use of them?
So I think to start out, I mean, I think a lot of patients don't realize how long GLPs have been around. Like when you take Ozempic, for instance, or semaglutide, they've been around a lot longer than people think, and people are always either shunning them because they're like, hey, like, you're going to use it, and like you're going to gain it all back. And I do think GLPs have changed the way medicine is going to end up going, because they provide so much benefit in the sense from an inflammatory standpoint. I use a lot of microdosing GLPs, even in my autoimmune patients that don't need to lose weight, because you have to look at the insulin function and kind of what it's doing and what each GLP does directly. It does help with the food noise, which is very helpful, and I hate to use the word kickstart. But sometimes patients need just a little bit of control in the aspect. But for me, it's about what's the lowest dose I can help a patient with where we're not losing muscle mass, we're hitting our macro counts. It has to be in the correct hands. You have to be looking at, I think, the ratios of body fat percentage and muscle, because if you lose that muscle metabolic burn, then yes, your metabolic rate is going to plummet, whether you come off or you can't have access to that anymore. I just think it's definitely, when used properly, it's a phenomenal agent or adjunct therapy for patients to use, but it's not the end all be all. A lot of people just think you inject it and it's like, hey, I'm just going to just lose all the weight. Or you have to put in the work too, and that's where we always do weigh-ins and check-ins, and I'm always looking at patients' protein counts based on their weight. But it's just like hormones too. You can't just inject hormones and go to the gym and think you're going to look like Arnold Schwarzenegger did, like
Right.
in his heyday. I mean, he put in a lot of work, so you have to put in the work too. GLPs are a form of peptide, but also there's other peptides that I think are so beneficial and have been around for so long. And I think there's always a misunderstanding. They just think peptides and growth hormone and, people that are going to the gym to help build muscle mass. But there's lots of healing peptides, like, for instance, BPC 157 is like probably one of the most well-known peptides on Instagram probably right now, because of what it's been shown to do, like in the lab, but also in patient populations.
Mm-hmm.
It's meant to help heal injury and help with inflammatory states. Like, let's just say you tweaked your knee, playing with your kids, or you had a slight tear in your meniscus. It's been shown to actually help that tissue bring in healing cells to kind of repair, but also decrease that inflammatory state that actually induces more injury. A lot of people think that just, I need to get a steroid shot. Steroids are good in the acute setting, and I still use steroids here sometimes if they're needed. If someone throws out their back, I'm not just going to throw an anti-inflammatory peptide at them, because it'll take a little bit more time.
Yeah.
Just like when you cut your hand open, it takes time for your stem cells and growth factors to come in and actually seal that cut in your hand. It's the same injury site. So there's lots of benefits to peptides when it comes to not only from a healing standpoint, but also there's other ones called, there's growth hormone, I would say receptor activating ones as well. You can go through all the names, Samorlin, Ipamorlin. These act in a little bit of a different way. It's not giving someone growth hormone, because when you give someone growth hormone, you're actively shutting down that pituitary side, which is something you don't want to do.
Okay.
When you can take a peptide, which a peptide is just a smaller structure of, an actual protein itself, it acts on the pituitary to release more growth hormone in the body to actually do more things, like improve sleep, improve metabolic rate, improve even cholesterol numbers, improve recovery time. So there's lots of benefits in peptides, and there's obviously we'll leave that for another talk, as far as, because I can talk peptides all day, but each one plays a role in the body in a different manner. I do think that's a very new way, but it's getting a little bit restricted, from certain standpoints of the healthcare system, FDA, everything. So again, you never know. Just like stem cells it's almost, that gray zone of, like, they do so much good that people, even my patients, will sometimes fly out of the country to actually go get stem cell therapy to heal their body. When we know these things work, why not utilize something that works versus throwing another medicine at someone? Like, we need medicine. We utilize medicines all the time, but why not use other things that are natural, that our body can heal itself, that work so well without the side effects?
Yeah, but I think what we have to think about is you're in this game. I mean, that's where you're at. If you look at a typical internist in a family medicine practice, they don't have the time to do what you do. They do, but they can't. They don't have the ability to. So they're not. You probably see a majority of patients in your community that are glad that they're not seeing their internist, because they would get old school medicine. I hate to say that. I mean, no disrespect in any ways, but you're giving them an advantage by coming to your practice to see them for their care.
Well, and that's I would say, me doing clinic and residency. My attendings hated me because I took way too much time. My notes would take forever to get finished, because you want to do a little bit extra, but they're like, all right, come on, like, write the script, like, make that another visit. And I'm like, they ask about nutrition, I have to, like, educate them, or at least do some sort of due diligence. And that's what pushed me to kind of do this style of practice, is because I got into medicine to make a difference and also help patients achieve and, create that more proactive longevity approach. That I do think it's a complete lost art of just sitting down and talking to patients. But again, that goes back to our healthcare system. Like, if you're not getting reimbursed for your time, you can't pay your staff, you can't pay your front desk person, you've got to pay a biller to kind of bill everything. And is that bill going to get fully paid? Or are you going to get fully reimbursed? And so it limits us as providers to be that in that traditional model. And patients get frustrated. They're like, I want to come, to your practice, but I'm already paying $2,000 a month for insurance. And that's the hard part of like, you pay $2,000 a month, but then you like, what's your deductible? Is it 2,500? Is it 5,000? And you spend all this money every year and you don't get to utilize it.
Yeah. Yeah.
And that's a very direct statement, but obviously it's not blanketed across the board. Insurance is beneficial, but I think that it needs to change on how patients can be a little bit more proactive at their care.
Yeah, it's true. I mean, people have to understand that there are choices that they make by having insurance, and waiting to go in and use your insurance when you think it's optimal for you is not the best way for your plan for optimal health in the long run, because it just isn't. You're waiting until you hit your $10,000 of your up max out of pocket, versus if you spent $3,000, $5,000, you'd get better already by seeing somebody in your position. I'm not, stating what your prices are. I don't want to, dictate what.
Yeah.
But
No. Yeah. But and that's what I found, even with COVID. I mean, I was very nervous with COVID because we are a membership model. And I was like, crap. I was like, man, like what's going to happen when, people don't want to pay membership? But I'll say this, that sometimes when you can scare patients enough and you can say, okay, like I'm not going this route of being this traditional model. And I'm not saying that there's not some phenomenal, specialist and internist out there, but it allowed us to grow from there because patients were taking that extra step and saying, man, like I really need to like what vitamins should I be taking? Is this a good brand, or like should I be taking this? And you have to really vitamin supplementation is a whole nother realm, but you have to take each patient into account and look at the micronutrient, even macronutrient counts as well, and then optimize each patient differently. So I would say that patients definitely took a way more, I would say, first step proactive approach to getting healthier, because COVID scared everyone.
Mm-hmm.
I mean, even just the virus in general, which we won't get into, but it's teaching people like, how can I optimize my immune system enough to where, whether it's COVID, whether it's flu, whether it's pneumonia, anything, like what can I do to kind of stay healthiest, longest, no matter like what comes around. That's what we enter medicine for, is to teach patients that aspect.
Yeah. People weren't as concerned about their health because they didn't think they had to be. I think it woke people up a little bit to say, okay, that what I'm putting in is causing me to look and act this way. I'm hearing what's happening because of COVID. People are dropping by the wayside. Maybe I shouldn't act or be that way. So they had to make, a change for themselves. And at that time, it's scary. But in the long run, they're seeing that it's a better choice.
Correct.
Yeah.
Yeah. I mean, patients always have questions. And again, unfortunately, yes, there's a lot of, very poor supplements out there that, say they do everything and make it massive claims. And But that's what my patients pay me to do, is that's what I'm here for. Like, yes, ChatGPT can be very, very beneficial, but it's not our end all be all. You still need me to kind of help you, guide you through it, and kind of just, quit Googling, quit looking at your friends. Let me be the cook in the kitchen. And then, we can add anything on. Like, I'm happy to answer questions. Like, if you have a question about something, just send it to me. Like, we will either say yes, no, or have a better replacement for it.
Okay. I love that approach. I think it's great. From your practice perspective, have you felt as though there's been an increase of people coming in for functional medicine, lifespan improvement, those kinds of things? Has that been more that you've seen in the last couple of years?
I'd say 1,000%. Thanks to, I would say this, I mean, obviously, when I first started coming out of residency, I mean, I didn't have a single patient. Not going that insurance model was very scary, and like the word of mouth of trying to, go to functions, go to, we did even in my neighborhood, we used to go and do cooking classes just to kind of teach neighbors how to kind of eat cleaner and eat better. I will say Instagram has done a phenomenal job in social media to help us as physicians and functional medicine specialists to spread that knowledge, to help people really take that active approach. Mm-hmm. Instead of just saying, okay, like, let me go to my doctor and see if he can do it. And he'd be like, okay, like, yes, I'll write it, but then I won't write any higher than this. So it definitely allows patients to I think, dig deeper and ask more questions.
Yeah. What are you focusing on in your business right now from, let's say, a growth perspective?
So I like to have my hands on everything, which I've learned to kind of back away. My managers are like, all right, like, don't answer all the text and all the emails. Just like, let us, delegate a little bit. So I would say for me in my practice, we utilize a lot of compounding pharmacy. And so I don't care who you use, like there's always going to be, you're going to run into a problem. And even regular pharmacies, I mean, I know you know this with Walgreens or CVS, and that's not bad mouthing any, but there's just, again, it's out of my control. For me, it's about customer service. And so we're in the midst of building a compounding pharmacy currently. And this is not just for my patients in general, but we want to be able to provide the highest quality care there is, that patients don't have to worry about, like, when is my medicine coming? Like, when's my hormone coming? Like, is it lost in the mail? Did they actually fill it? And so I've tried to use compounding pharmacy all across the country. So that's one aspect of this. But then I've also, a very good friend and a business partner of mine, we've actually started a telemedicine company as well, to allow, obviously, to spread not only myself, but to be able to utilize patients across the country to be able to provide that care, because a lot of patients can't come into the office. And so I'm fine with a Zoom visit or a Zoom call, because we can still do this and still get labs done and still guide them through a telemedicine visit. Yes, I like face-to-face. I'm very old school.
Yeah.
But that's kind of the growth model that I'm looking at and setting is not only from a compounding pharmacy standpoint, but also being able to kind of expand my knowledge, because I love to teach so much as well, and just be able to, I would say, expand the practice that way.
Yeah. What would you say is a current challenge that you have in the practice?
I think going away from, we kind of hit on this, but not really, but I'll kind of just circle back around, more that traditional model, where everyone's trying to change someone's mindset of, like, I pay for insurance. Like, why can't I use my insurance for this? Can I use this lab company? I think that's the biggest struggle in my practice is educating patients on why we need to invest in your health is prevention. So getting away from, like, again, it's just saying insurance is very limited. And, like, there are some times where I'll actually utilize a patient's insurance, whether it's imaging or, just a cardiac scan or an MRI. Yeah. So we'll utilize it that way. And so building a note and then sending it through the insurance. Again, I don't do any of the billing, so that goes through someone else. Mm-hmm. But that's, I would say, the biggest struggle is getting away from the traditional model and understanding a monthly concierge model. But once they're here and once they see how much hand holding there is and, like, how much education we provide, it's kind of just a game changer for patients.
Consumers need to understand that insurance is typically sick care or injury care. Wellness care is not typically paid by it. And that's where you've got to say, okay, every once in a while, keep a couple singles in my pocket for when I need wellness care, which you need it more than you need sick care. So if you could split your paycheck into sick care money and wellness care money, you'd be going through your, and divert that sick care to wellness to be better. And you'd see more patients, and they'd understand that it's healthier.
It really is. And I think that, and a part of my practice, like with our monthly membership, we do offer more of that urgent care side. And again, these are patients that I know very well, whether they need something, whether it's a UTI or, some sort of candidiasis, like we can write something for them directly without having to go spend money and go wait in an ER, wait in urgent care. So I try to kind of provide, there's only so much I can do. I don't have a mental x-ray machine so there's sometimes when I'll send patients obviously to the ER or somewhere else, but we try to kind of have everything under one roof. I can't do everything. I'm not a GI physician, but we oversee mammograms. We oversee, a lot of injuries as well, because that's more the regenerative side of the practice. I mean, we do injectables as well. So we try to kind of do as much as we can to prevent. And then if something's wrong, then obviously we send them to a specialist.
Okay. Yeah. Well, that's important. I'd love for you to share a success story of a patient that's come in and, I don't want to say they're at their last hope, but can you share a great success story from your practice?
I have a couple. I was going back and forth on which one. I would say the most impactful one would be, it's actually a husband and wife. They're about 50, 52 years old. Came in, I've been battling some issues for about, 4 or 5 years, just kind of let things go, and just very, very down. And just, they actually had a daughter pass away at a very, very early age of leukemia, which kind of put them into a little bit of a spiral. And obviously, no one can even imagine going through something like that, losing a child. Yeah. And so when they came to my office, they were just looking for just answers, just first steps. And so for me, both were at the age where they both needed hormone replacement therapy. So that was the first step of looking at kind of screenings. What have they done? So we kind of helped write them each a plan. In my office here, when we built the office, we actually have about a 2,000 square foot gym as well. So we have personalized trainers as well here. So I try to create that one-stop shop for patients. And so we set them up with one of our trainers. We help get them on a hormone plan, a nutrition plan, and optimizing. So I was actually just looking, I actually just saw them just the other day, which they're almost unrecognizable. So between the two, I'd say, wife lost about 70 pounds within,
oh, wow,
probably about a 12-month period. Super healthy. Joints feel so much better, much more motivated. It's not even just the weight so much for me. It's also watching that body fat percentage go from like the 40s. It was like 40, 45-ish, all the way down to kind of like the upper like 20s, which is very, very, that's a really good fat reduction. For him, he actually gained weight, which people are like, well, that's not really a success story. But it is, because he came in at about 200, 205, and now he's about 215, 217 now, but that's all muscle.
Muscle, yeah. And
went from really the high 30s body fat percentage all the way down to about 14.
Wow.
So that's it. So that's a big shift. Obviously your males have that a little bit of a bigger shift just because of muscle mass. But I think for me, just hearing the story and hearing where they were, and they were just so ready to kind of get out of that just lull is what I call it. And just trying to find an answer of like, what's the first step that I can do? So like, for me, that's probably like my most passionate story of just hearing, coming from that, because I have 3 children myself, and just, again, it's not fathomable. Yeah. And so I think it's so nice to watch where they become they're in our gym every single day. So
really? That's great.
Yeah. So that would probably be like one of my, that probably hits me at my heart and soul the most. Yeah. I have another one, but that's more of a younger patient that we helped. But
okay. Well, again, that, as you say, it's unimaginable to see what would happen, but I can only, it gives them hope. They're around other people in your gym, not only just themselves, but other people in the gym. Yeah. It gives them probably more purpose and meaning than they had before. Yeah. And they're feeling better in that process, so that's life altering in a positive way. So, we'll share as we kind of wrap up here, Doc, we'll share all of your links in that. But if somebody's interested in what you had to say, which I don't know why they wouldn't be, but if they want to learn more about coming into seeing you at your practice, where would you like to direct them, or how would you like them to find more about you?
I would say 1 to 2 ways. We have an Instagram. Oh gosh, my marker's going to kill me. I have 2 Instagrams. I think it's Dr. Hogan. And what I'll do, I'll send a link below, but okay. I would say email is usually the easiest, or Instagram. Okay. And we have info@lvwell.com is one. And then just our Instagram page, which is just LVWellness Aesthetics.
Okay. So I'll make sure to drop those links in there for you for sure. So 2 last questions. If you could give one piece of advice on how it would affect people in a positive way, like from healthy, successful advice, what would that be?
I think for me, this will be very simple. I think just teaching people, looking at the staircase, to take 1 step. Like, it's just taking that initial step forward just to get that momentum going. But also remembering that, we're only here for so much time. You only have so much time with your kids. And so it's teaching patients, how can we live the longest, but in a healthy way? It's almost being that model for your kids, or even just who you surround yourself with, and just keep going. We're all going to falter. We're all going to fall on our face. We're all going to make mistakes. But I think just getting back up and just taking that 1 step.
Yeah. I like that. No, I've not heard that before, looking at the staircase just one step at a time. I know I want to get a better workout. I'll take 2 or 3 steps, but
Oh yeah. You're trying to get up the staircase, but then it's like January 1st. It's like, you do so much at once and
yeah,
you trip and fall
yeah,
on the stairs. So it's literally just change one thing at a time.
yeah. I love it. So you're on the Prime Health podcast. I always finish with this. What would your definition of Prime Health be?
I think for me, it's just, and I probably use this word too much, but I think being primed and being optimized is my kind of thought on overall prime health. It's really providing yourself with the tools to do better, take the proactive approach, and just really, really ask questions and dive deeper instead of just saying, okay, and just like this, it is what it is. I think that you have to really kind of just ask questions more and just, again, just find some more answers and just find a really good provider that can help kind of guide that hand
Mhm.
on prime health. But I think it's really, really just focusing on those pillars that I think are just really, really well, whether that's hormones, functional medicine, and just nutrition.
Yeah.
So
I appreciate that. I'm very selfish in the fact that I get to do these podcasts all the time. I get to learn different aspects in it. I get to hear what makes, lives better. So I appreciate what you're sharing with us. So Dr. Hogan, again, thank you very much for being a guest.
I
Always do.
appreciate it.
Yeah, absolutely. I do want to say this. There's things that you said that are key insights into people having better health. So when people listen to this or when they watch this, I always say, please think of that one person that you met. We'd love for you to share it to more people, but that one person that you think could benefit from this, whether it's locally where Dr. Hogan is at, or because he's doing the telemedicine as well, wherever it may be, try and share that because that will make it impactful. It could be another success story for Dr. Hogan and how it not only changes that patient's lives, but the people around them. For me, selfishly, I always say, of course, subscribe to our podcast. We'd always love to have more people that are watching us. But until next time, remember that true wellness is a journey. We're all on this together. Now, whether you are taking charge of your own health or having amazing physicians like Dr. Hogan guide you in yours, we always just ask that you stay committed to your Prime Health journey. And again, Dr. Hogan, thank you very much for being a guest on the Prime Health podcast.
I appreciate it. Yeah, thank you so much for having me.